rabies, which is fatal, but can be avoided once appropriate vaccinated. This is an initiative from Cadila through its innovation to serve the society and mankind. The topic of the webinar is novel 3-dose G protein unlimited T2 compliance. Dear Dr. Rabies is the world's first novel 3-dose anti-rabies vaccines, and with great pride, we would like to inform you that Rabies has successfully completed 1 year of launch, with more than 40 animal bite victims being vaccinated. 100% compliance was recorded, and no case of adverse effect has been registered. With this, it is my honor to introduce to you to the speaker of today's webinar, Dr. Suresh Krishnan sir, having a specialty of MBBS, MD, internal medicines, and sir is practicing in Atria Hospitals, JP Nagar. So now I'd like to request Dr. Suresh Krishnan sir to initiate the talk, and later on we will have a question and answer session. So I'm handing over the session to Suresh Krishnan sir.
Good evening, everybody. So globally 59,000 human deaths annually. We can see from the dog bites. Approximately in India, it is around 20,000 human deaths, accounting for 60% of rabies death in Asia and 35%. 91% occurs in the rural India. So every 9 minutes, a person dies from rabies according to this data. The first aid is local wound treatment like washing in soap, continuous flow of water, and all. Active immunization and passive immunization. Passive immunization, we are going to give rabies immunoglobulin. Active immunization, we used to give 5 doses. The patient has to visit 5 times, that is 0, 3, 7, 14, and 28. Anti-rabies vaccine was given all these days. So one of the main problems with this was non-compliance, and current rabies vaccine or cell culture vaccine, inactivated vaccines are, the technology is quite old. It has inconsistency in the potency and stability, availability, there is a short supply, and some adverse effect has been noted. So non-compliance is a major issue. So the complaints, the complaint who received full course, that is the scheduled dose recommended. Delayed complaint is within 60 days, but completed the dose. Dropout is who had taken at least 1 dose after the animal, but not completed the scheduled doses. So according to the WHO recommendation, rabies post-exposure prophylaxis practice in the view of new centers for disease control prevention. WHO retrospective analysis done at travel clinic. Total of 100 patients who received the rabies vaccine, 4 doses post-exposure prophylaxis. Shortcoming was late initiation, administration HIG, antibody levels were very low, that is only 0.5. International patient do not always receive optimal dose with the rabies and post-exposure under real-life conditions. The significant proportion did not develop adequate antibody level even after the 4 doses. So this is non-compliance. When we see the 3 cases, 58-year female, 38-year male, and 34, all of the 3 doses they have taken. So outcome was hospital survival of 16 days, but died after 1 day due to LAMA. LAMA on the same day followed, and for death followed 2 days, expired on the day of second head. That means to say the poor compliance will lead to the grave outcomes. So original complaints of poor exposure prophylaxis among animal bites, a hospital-based epidemic study at Safdarjung Hospital, the number was a good significant number, 360. 53 were non-compliant to the full course of ARV. So the complaints of anti-rabies vaccine post-exposure. So day 1 was 100%, day 3 was 88, day 7 was 85, day 14 you can see there's a significant drop, 70%, and day 28 it is almost 60%. Constraints, it interferes the distance of hospital, school timing, cost incurred, forgotten dates, loss of wages, etc., because it is a mainly rural issue. So evolving vaccines is in 1885 it was a live attenuated vaccine to the spinal cord. Later in 1911 inactivated lipid preparation. 1976 it is inactivated vaccine through the cell culture. So initially it was 31 injection, 14 injection, and later on it was evolved to 5 injections. Non-compliance led to the evolution of treatment regimen from 31 doses to 5 and still on. Meeting the unmet needs, introduced the novel vaccine with a simple and short regimen. Novel 3-dose recombinant rabies G protein vaccine will sort this problem. The first protein subunit prepared by VLP platform, first vaccine with 3 IM regime 037, better compliance due to easy flow of regimen, convenience, ready to use, no reconstitution needed. It's a native, they have taken a native virus and the development of G protein, and the vaccine was developed. So it is the through the nanotechnology. So the viral mimic antigenic mimicity will be better. So study, so here we have taken the study zero protection data. You can see 0 to 3 doses, 037 3 doses, 10 microgram, 50 microgram, and the rapid pool they have compared with 037, 14, and 28. When we compare the antibody protection, zero protection data, we can see the 3 doses vaccine has got a better zero protection. So this is a study safety and immunogenicity of novel administration as simulated post randomized comparative controlled multicenter trial. So this the 800 patient was taken. The regime was 267 subjects for 5-day regime. 533 patients were taken for 3-day regime. So when we compare the local adverse effects, systemic adverse effects, and zero protection, all the 3 efficacy, it is almost 98% to 100%, almost significantly. The common systemic side effects was fever, which was less in the 3 days, ear pain little bit more, headache was lesser, and urticaria was little bit noted, and joint pain was lesser. Nausea was not noted at all. So novel 3 days was inferior to the refer vaccine, less adverse effect compared to the reference vaccine, was found to safe and immunogenic compared to the 5 doses WHO pre-qualified vaccines. So it has got a global awards like Pharma Innovation of the Year, Golden Globe, Tiger Awards, etc. So thank you. By this, we can understand that 3-dose regime is beneficial for the patient, not only for the compliance, for the immunogenicity and final outcome for the protection of rabies and prevention of rabies, which is one of the goals for India as a national policy. Thank you.
So, thank you, doctor, for giving the insight information about 3-dose explanations. Now there is 2 questions asked by the doctors. So the question the doctor asked is 2 questions. One that is from Dr. Maltens. Dr. Maltens is asking, what are the common symptoms of rabies?
Common symptoms, initially it is painless. Once the rabies is developed, it is usually the tingling sensation, painful limb, and opisthotonus, means the pain that the patient will have a bending of the spinal cord and rigidity and vomiting.
Thank you, sir. And the last question is asked by Dr. Ravindra Belli. Doctor, sir is asking that as you are prescriber Travis, what is your clinical experience about the molecule?
Yeah, the 3-dose regime which we are talking about has shown better compliance, and there is a lesser side effect, and the patient acceptance is very good. And most of the patients, they have completed the dose, which can assure the patient that they can be prevented for the rabies.
Thank you, doctor. Thank you so much for Dr. Suresh Krishna for the informative talk. We truly appreciate your effort. Last but not the least, we would like to inform you that TAVIS has won 2 prestigious awards in innovative category, that is ET Indian Pharma Awards and Golden Globe Tiger Award. Thank you, doctors, and thank you all the Dr. Parshad. Yes. Thank you, sir.
Kajal sir. Hello. Hello, Kajal sir.
Hello, hello, ma'am.
Sir, tech support meeting is over. You can conclude.
Okay, thank you.